and someone now who's going to join us and knows a lot about building healthcare ecosystems, again, is someone who's been a big part of what's going on in the digital health, not just the revolution, not just the evolution, but now the reset that's happening. Again, Bijoy, I really appreciate you coming in off of the tremendous day yesterday of being back as a group in person on campus with just hundreds of people from all over the world joining in online and as well as on site. But would love to talk a little bit more about equity in the digital health world. We know it's a major issue. We know that people are really struggling to get there and bring equity there. Health equity and certainly diversity, equity, and inclusion are two hot topics right now within our lab and within most enterprises and institutions around the country and around the world. And we'd love to hear more about what you guys are doing at Bayer and what some of the advice that you have. But let's start off again as well with your journey. And again, I'll go off camera so you can really tell our audience today from around the world what you're doing and how you're tackling it.
Yeah, thank you very much. I had a few slides. I don't know if those are loaded or not, but good morning, everybody. I'm glad to be here. Wish I was there in person. I have been now in the CIDO role in Bayer now for about 3 years, and before that I was with Stryker in a similar role. And I want to talk a little bit about the role of the patient journey in digital design, because one of the things that we are doing really well, including in Bayer and across the ecosystem, is we are actually making a lot of progress right now in getting the maturity in the algorithms, paying a lot of attention to the data, looking at really good use cases. And those things are all working really well. And I see a tremendous amount of energy. As the previous speaker said, it's still an ecosystem. There is no way this can be built only by the tech or by health professionals, but we also have to look at the larger ecosystem. And the biggest missing spot, if you will, is really the voice of the patient, in my opinion, because the largest unmet potential is really in how do we do design for the actual patient. And if you look at chronic diseases in particularly, because chronic diseases, obviously, as we know, is the largest healthcare cost, and it is obviously driving the biggest amount of comorbidities as well as bad outcomes in the population. And most cases, when I see the platform play that we are now embarking in, the usability aspect of it is a big struggle. Why do I say that? Because from a point of efficacy and safety, I think we are making a good amount of progress when it comes to PMA devices and of course 510K. But are these usable, these tools usable to the patients who have comorbidities, who are not in their best physical or mental acuity, who have technology deficits? And the downside of that is we have a potential to exacerbate the divide between the haves and have-nots, if you will, in the ecosystem. And therefore, I think it's really important that we look at the social determinants of health. This was the slide I was going to talk a little bit about. And what do I mean by that? So if you look at race, age, education level, gender, all these aspects are actually going to drive your disease outcome. You actually see that, for example, race has a significant statistically meaningful difference in when you seek treatment, how you seek treatment, and how much you trust the healthcare system. And when the tools don't account for that, what ends up happening is the onboarding into the digital journey happens late and the drop-off happens earlier. And as a result, long-term prognosis, you don't see as much value from these digital tools. And that is something that now we are actively thinking about, how do we address this? And if you think about the way we even talk about approvals, usability is sort of not the biggest driver. It's always efficacy and safety. And if you're not building and designing these tools early on with respect to, there you go. If you could go to the third slide, that'll be great. Sorry about that. Slide 3, please. So I'll go, I mean, I don't want to go back to this slide, but as I was explaining why chronic diseases is the largest opportunity in front of us. So in this particular slide, what I wanted to show was that there are lots of proximal mediators that actually drive the disease progression. And most of the design today is focused on the clinical and the technical parts of the design. And it somewhat, we are necessarily not paying the attention on all the other aspects, such as income, race, religion, family size, trust in the health ecosystem, values of health and illness, and all of these factors are going to drive the adoption rate by the patient. So these health and tech intersections, it doesn't really matter in the R&D side or in the side for physician use. But when it comes to tools that we are now pushing down into the patient, this actually really matters. Slide 4, please. So treatment protocols are really effective, obviously, in containing chronic diseases, as we all know. But we constantly see that adherence is a problem when we actually move the adherence to the patient and not to the healthcare ecosystem. So the disease stage, comorbidities, treatment options, all are the clinical drivers that affect our adherence. But the patient behavior, social determinants of health, and provider behavior with the patient is also driving the adherence. And this is where socially aware design really matters, because if you are designing for the patient, you're going to take into account this so that we actually keep the patient in the protocols, which drive the digital health solutions to be really successful in the future. Next slide, please. So we know these are really useful. We know that there are a lot of platforms already available, but the path to monetization is still elusive. And I see that across the board, all companies are struggling to some degree with how do I effectively monetize. And this is where the point I was trying to make earlier, which is marginalized communities have a higher incidence of chronic disease, and they also have the largest amount of digital gap or divide compared to the standard population. So when we design, it's not only just enough to design for all patients, you have to now also think about designing it for the patients who have the largest digital divide, which means what is the technical familiarity with the tool? What is the font size? How do you actually make sure that the button placement is in a helpful way for somebody with less physical acuity? So these things have to be built into the design, and that's where I think we need to have further leadership conversations between tech healthcare providers in how do we bring in the ecosystem into the conversation. That includes allied health providers, such as social workers, nurses, and other people who are touching the patient, including the home care providers, because the ecosystem around the patient drives this conversation a lot further often than the patient themselves. Next slide, please. So as we are thinking about the platform designs now, especially in the chronic diseases, this is sort of how we are thinking about it. We are looking at the context, then actually looking at the clinical health barriers, and then looking at the usage barriers, and then trying to design a socially aware design. And to me, these are early days. We still need to have a lot of conversation in this space. And I hope that in the coming hours, you keep this in mind as you look at the potential for how do you drive this forward. Because if you only think about clinical and only think in terms of how do we think about the data, at the last stage, you have to enable the patient to self-drive some of the care for the care to be truly effective and meaningful. And to do that, you have to really think about the usage barriers. And usage barriers are not the same for everybody. So particularly when we look at gender and race, the data indicates that these are really barriers in the way people actually work with the tools and how long they stay and how they drop off. And for us to convince Medicaid and Medicare to make digital health tool a standard of care for a lot of these chronic diseases, we have to be able to keep the patient on the platform long enough to demonstrate improvement. And that, I think, is the struggle we can overcome with socially aware design. So that's all I had in terms of a conversation here, just to make you think about how we do that. My perspective in Bayer is that as we think about platforms in health, we are trying to now look at this as the building block of everything that we are designing. And that means we have to get better at getting the patient share of voice early in the journey. Thank you.
No, thank you, Bijoy, and great presentation. You know, when you're looking through this work and really just this the scope of work that you've engaged in over the years, and you're looking at now the digital health reset, and you've seen over the last 3 years unprecedented numbers of amounts of resources and funding, people really helping and doing everything they could to improve healthcare delivery, first virtually and then holistically. What is it now that you're seeing, or if there was one point of truth that you would point to, that you would direct people to pay attention to, what would that be? What would be like almost like the elevator pitch for user design in this digital health reset?
It is to get the voice of the patient and the patient support ecosystem early in the design document stage. So what we are now doing is we are using those at the last stages, right? So if you think about a standard pharmaceutical approval model, you don't engage the patient ecosystem until after the approval when it comes to use. I'm not talking about the clinical trials, I'm talking about the actual use. But in this case, you have to flip the model and get them involved early on, which includes people like social workers, because they actually touch the patient in more direct ways than even the physicians and nurses for chronic care. In my previous role, I was looking at episodic care, right? So if you're looking at medical devices for episodic care, this is not as much of a problem because those are short, well-defined episodes, and you can actually drive the care much more strictly. But in the chronic care diseases, that's not the case.
And when you're doing that, when you're collecting that patient voice, and again, we got about 1 minute left. I know it's a very deep question, and I know it's a very big question, but what's the best methodological tool? Obviously, given the enormous amount of research that we do at the lab, we're always looking at instruments, we're looking at methodologies. What's the best methodology you found for collecting that patient voice?
I would think early focus groups are probably the first pathway, but you have to drive it through the physician ecosystem. So it can't be you go directly to the patient, that doesn't work so well. You have to build the trust. And in many cases, what I'm seeing is, especially with marginalized populations, trust building is the first phase in this equation. Otherwise, you're not going to get the attention that would help us design better.
That's wonderful. Well, again, you know, I know it's early, and I really appreciate your time to jump in here and kick off day 2 of the HITLAB Summit and really bring up the most important piece, which is it's all about the patients and making sure that when we start working with patients, we really start with the patient voice. Thank you, Bijoy. Have a terrific end of the year. Wishing you you and your family a great holiday, and we'll talk to you in 23.
Thank you. Same to all of you. Thanks a lot.
And that again, I think we can't understate the importance of the patient voice. And obviously, you know, Bijoy and what he's doing as EVP and Chief Information Technology and Digital Transformation Officer at Bayer, just an incredible perspective there to understand that really it's important to start with that journey with the voice and some of the methodologies there.